Good afternoon, all. My name is Dr. Santoshi Nagaonkar. I'm one of the urologists at PD Hinduja National Hospital, Mahi, Mumbai. And today we are going to discuss about some urological issues, and more so I'm going to concentrate on some newer technologies which have been evolved in the last few years. And the landmark invention which has occurred in medicine and in surgical field is the robotics in urology, or robotics in surgery actually, and I'm going to concentrate more so on robotics in urology. So before I begin talking about the actual topic, I would like to enlighten most of you about what this branch means, the urology. And there are two different things which people often get confused about the urology and nephrology, and one should know which doctor deals with what condition. So it is just like a cardiologist and cardiac surgeon. The cardiologists are the heart specialists, and they treat these heart conditions by giving medicines and certain interventions, while the cardiac surgeons, they actually perform heart surgeries. And similarly, we have urology and nephrology, where the nephrologists, they treat kidney conditions by using medicines and dialysis, and they are also involved in kidney transplants, whilst the urologists, they treat certain kidney, bladder, prostate conditions by surgical method and medicines as well. So for lay people, there may be a thin line of kind of demarcation between nephrologist and a urologist, but yeah, there is a huge difference. So that's about it. So the urologists, basically they treat conditions like kidney stones, urinary tract infections. There are certain urological cancers which have been detected quite commonly nowadays. Those are mainly with kidney, prostate, bladder, testes, penis, and there are some endocrine glands like adrenal glands. So these all conditions are covered, and they come under urological diseases. Besides that, there are certain symptoms which people should be aware of, where they can seek help from a urologist, and those symptoms are mainly blood in the urine, or burning in the urine passage, testicular pain. So all these symptoms could be addressed to a urologist. Now, I'm going to discuss about robotics in urology, but one should know what is robotics. We talk about all these new technologies, we use big words like laser and robotics, but do we know actually what it means? Or it's like a robot which we watch in several movies, where there are certain kind of robots, they come into the operating theater and they operate on a patient. No, it's not true. So I thought I'll just have a kind of one-on-one communication with people who are logged onto our Facebook page, and if they have any direct questions, those questions could be addressed here itself, so we can just clarify certain issues. So what is a robot? Now, robotic surgery or robot was initially evolved by the United States military, and that was basically with the intention of attending to the injured soldiers on the battlefield. So even if the injured soldier is somewhere in Iraq, and instead of jeopardizing the surgeon's life, you can send these robots, or you can make some robots available on the battlefield, and they can operate remotely through that robot. So the surgeon may be sitting in America or in Canada, and the robot is actually dealing with the injured soldier on the field, so that the actual life is not jeopardized or compromised. That's how it was evolved, but it was never popularized and never commercialized. So one thing I'm proud to say, that though the first robotic surgery was done by one of the European surgeons, And initially this robotic surgery was utilized by the cardiac surgeons. The real exploitation of using this robotic surgery was done by an Indian-born, Indian-trained surgeon in the US, Dr. Mani Menon. So I'm very proud to take his name because he popularized this technique. He took nearly 8 or 9 hours to perform his first robotic prostatectomy. That was way back in 2001. And since then, this has taken a big leap in the surgical field. So if I give you an example, in USA, America, Canada, 95 to 98% of the prostatic surgeries for prostate cancer, they're performed by a robot. And it is such a popular technology for various reasons. It has just not become popular because it is something new, or it has got a big name. It's not like that, but it has definitely stood the test of time. It has been a proven technology, and it has got many advantages in treating not only prostate diseases, but there are certain other conditions which could be treated very effectively by using a robot. So basically, robot is it works on a master and slave technology. Robot does not have its own brain. It cannot think on its own. It has to be given a stimulus by the surgeon or the operator to make that desired action. Unless that has been made, robot will not even move by a millimeter. It will not have any of its own brain. So a typical robot nowadays is like a 3-piece equipment. It's quite a big equipment, and there is a lot of investment involved as well. That's why in India we are still lagging behind in acquiring this technology in most of the hospitals. So just to give you an overview, I think in all across India we have got about approximately 70 robots installed, and in Mumbai we have close to 12 robots. And again, I'm proud to say that in Hindujana we have got a robot installed about 4 months back, which was long due. And it is one of the state-of-art technology because it is first of its kind robot in India, which is a complete robotic system. So it's not only the robot which has arrived in Hinduja, but we have got a robotic table as well. And we have got several trained robotic surgeons. So it's a good team of work we have here. So coming back to the master-slave technology, so robot has a standalone machine which has got 4 arms. They are quite big arms, but their movement is phenomenally superior than our own arms because it doesn't have any tremors. It has got multiple actions. So if I give you an example, if my wrist can move all around in a circular manner, it will move in 360-degree rotation. But a robotic arm or the robotic wrist can move to about 560 degrees, which is quite a bit. So I can reach in every nook and corner of the patient's body, and I would be able to perform the desired objective for that particular condition. So that is the biggest advantage. It has got a very precise maneuverability. So these 4 arms, they are multitasking, and basically these arms are connected to certain cannulae on patient's body. These arms are in turn controlled by a surgeon who is sitting in the operating theater on a specialized console. So console is like a very hi-fi chair on which we have got different joysticks, you can say, and there is a 3-dimensional viewfinder. So the surgeon is looking through the viewfinder. The robotic arms are connected to patient's body through the cannulae. These cannulae are inserted inside the patient's body, and there is a 3-dimensional camera which is attached to one of the arms, while the 3 other arms, they are free to be used for doing the surgery. and everything is inside patient's body. So when actually the surgeon is looking through this three-dimensional console, the view what we get is as if I'm sitting inside patient's body and operating on that particular organ. It is that kind of vision. Now we feel that what we see normally is a three-dimensional vision, but it's not true. It is a pseudo three-dimensional vision. But the actual robotic vision is real three-dimensional vision. That's why it is more superior. It is magnified. It is 10 times magnified. So if I'm operating on a structure which is only 1 millimeter size thick, I will see it 10 millimeters. It's like 1 centimeter thick structure, which will be very easy for me to take sutures through. So basically the surgeon is controlling through his joystick all these arms, and these arms will not make a move even for a millimeter without the surgeon intending to do so. And the third part of the robot is a large screen which gives the outside people who are assisting us along with the robot, they can actually visualize what is happening inside the body. So that's a typical setup of the robot. Currently, there is only one company, the US-based company, which is manufacturing this robotic equipment, and it has evolved over a period of time. Now we are in the 5th generation of robot, and it is going to be ever evolved. So we are not too far from reaching to a stage where the robotic surgery is going to replace eventually many of the surgeries. So that's the introduction of about the how the robotic surgery works. Now coming to certain issues where can we apply this robotic surgery? Can we do all surgeries by using a robot? The answer to that question is no, because there are certain surgery which still need a surgeon standing by the side of the patient, or we have to cut open the patient, and a surgeon cannot be replaced. Robot cannot have its own brain. Surgeon has to give the command. Robot cannot think the inside part of the patient. Robot will not know what is the inside anatomy of the patient. So the surgeon has to be there to operate the robot. A nurse cannot operate the robot. Even any ordinary surgeon cannot operate the robot. There are trained surgeons who have been trained on the robot, they can operate the robot. So there are definitely licensings and other stuff involved with the usage of the robot. Now, there are certain urological conditions which are very effectively treated by using the robotic surgery, and the topmost is, or top of the list is the prostate cancer. So localized prostate cancer, the cancer which is still confined to the prostate, can be operated by a robot. There are different types of treatment modalities available for treating prostate cancer. I'm not going into the details of that, but in case a patient is suitable to undergo a prostatic surgery for prostate cancer, then robotic prostatectomy has got several advantages over an open prostatectomy. The other conditions, such as kidney cancers, they could be treated with robotic surgery, bladder cancer, and adrenal cancers. Apart from urology, I can just give you a brief overview of what other branches they can utilize robotics. So cardiac surgeons, they have used robotics. Gynecologists, they have used robotics in a big way. The colorectal surgeons, liver surgeons, so colorectal surgeons are those who deal with intestines and rectum. So all these specialties, they have been utilizing robotic surgery, and it is getting more and more popular because several advantages. So this is about the robotics in urology and the other fields as well. If I'm more than happy to take the questions from you people, and instead of, there is a lot to talk about robotics in urology and robotics in surgery. I can go on talking for an hour, but best thing is to stick to the question answer session and see whether we can address to these questions from different people, those who are logged on. And if there are any questions, I'm more than happy to take them right now. Okay, so there is a question which has come through Kiran, and I don't know whether it is he or she, but Kiran is asking, does robotic surgical advantages translate to benefit for the patient? So basically, in simple words, what are the advantages of robotic surgery for a particular patient? Of course, it has got several advantages, and the biggest advantage is it's a very small scar. In a typical open surgery or a conventional surgery, a patient will be cut open depending on the need of the surgery. So average incision or average scar one patient would get from any surgery maybe around 8 to 10 centimeters or maybe more. Like for kidney surgery, and if the patient is obese, he will end up having an incision which is as big as 1 foot. Or for prostate surgery, the incision may be somewhere around between 8 to 10 centimeters. So in robotic surgery, of course, the scar is not completely eliminated, but we make tiny holes on patient's stomach. Through the holes, we put cannulae, and those cannulae are attached to the robot. So patient will end up having tiny 5 incisions on his body, and the healing is quick. The pain or analgesia requirement or the painkiller requirement is extremely less as compared to the open surgery. Patient is mobile the very next day. Recovery is quicker. Because the incision is so small, the infection rate is very less. Again, with conventional surgery, because if the incision is quite big, there is always a possibility of developing hernia. Hernia is like a protrusion of abdominal contents through a weakened scar. But if the scar is smaller, the chances of herniation is less. The inside part for the surgeon, the bleeding is less, so the chances of somebody needing blood transfusion is significantly lessened. The movements, what we could achieve internally, are extremely precise, and the maneuverability of these arms, which I mentioned, it gives 560 degrees of movement, is very outstanding, and that helps the surgeon to operate in any corner of the body. Again, for surgeon, it is very comfortable because surgeon is not standing all along. So sometimes we end up standing for 8 hours, 10 hours for operating on the patient. But here, the surgeon would be sitting on a console. The vision, what he gets is 3-dimensional, magnified vision. So again, we'll be operating by staying very close to the patient's particular organ, and we can take care of the bleeding, we can take care of the nerves which have to be preserved, we can take care of certain important structures which need to be secured while doing surgery. So these are the few of the several advantages of robotic surgery, and as your question says, that directly gets reflected or translated on patient's recovery as well. So the outcome for a particular patient coming out of the surgery is extremely good. I hope that answers your question. There is Pragya who is coming out with a question. She asks me, robotic procedures in urology, is it risky? Very good question, Pragya. Any surgery has got its risk. It's, for that matter, any activity what we do here, it has got some kind of risk. And robotic surgery is not devoid of that. So any kind of surgical complications which are there in an open conventional surgery, same thing applies for robotic surgery. But as I mentioned in my previous answer, the possibility of certain complications are reduced with robotic surgery, like herniation, pain, chances of infection is also less because the scar is less. So that is reduced. So definitely these risks are reduced. Now you may ask me if there is any particular or specific risk which is involved with robotic surgery. Of course, robot is, it's a technical equipment, it's a mechanical equipment, it has got thousands of electronic components, and the machine can fail. Now, even if machine fails, at the most what it will do, it will just stop working. So you are the arms are in patient's body and suddenly you feel that the arms are not moving. It happens extremely rarely. It hasn't happened with me at all. And biggest advantage of these robots are constantly connected through the LAN connection, through the internet connection, and they're centrally monitored from the US based office. So if there is any kind of error happening in the machine, that will be immediately picked up online on site in the US, and that will be rectified from the third party itself. We also have a person from the robotic company constantly available in the operating theater. So basically there are no life-threatening situations which could arise with robot. It will be just a mechanical failure, in which case you can overcome that mechanical fault, but these faults are extremely rare. So it may happen, I don't have the database for that, but it may happen probably 1 in 1 lakh cases, that when the robot just stops working. And just like any other computer, the easiest thing is to shut it down and turn it back on, and it's back functional. But you don't have to get worried. These are all minor issues. So yes, there is a risk, but it's not much, and the other risks are reduced with robotic surgery. So there are a few more questions coming up. That thing is going. Yeah. Okay. So Parinitha, she is asking me, hello doctor, what procedures can be performed using the Da Vinci surgical system? So I don't know, Parinitha, whether you were logged on when I actually began talking in the beginning, and I can brief you again. I did cover that part in the initial part, but yes, the urological procedures which are covered or which could be operated by using the robot, mainly the cancer surgeries, where in prostate cancer, kidney cancer, bladder cancer, that can be done with the robot. There are certain reconstructive procedures, plastic surgeries in urology, like pyeloplasty, where patient is born with a blocked kidney, and we have to cut part of the ureter, which is the tube connecting the kidney to the bladder. And once that connection is established, we take some sutures, and that suturing is extremely important, and that could be done with a robot. So these are the surgeries in urology which are commonly performed by using the robot. Having said that, there are other branches which have been exploiting the use of robots. So colorectal, that is the intestinal surgeons, hepatic surgeons, liver surgeons, cardiac surgeons, gynecological procedures, head and neck surgery, these are all performed by robot. Of course, there are certain indications for each condition. Not all surgeries or not all conditions can be treated by a robot. So robot is not a magic equipment. It has got its certain indications, and the surgeon will tell you which procedures could be well done or well performed by a robot. I hope that answers your question. Next question is from Avantika Sharma. What are the benefits of robotic surgery compared to traditional methods of surgery? Again, Avantika, I have addressed that issue on 2 occasions, so I wouldn't really touch base that again. I think you were logged on during, I hope you were logged on during that time. Pragya Modi, very commonly asked question, and I love answering this question. How much does robotic surgery cost? And I think in India, in a country like us, it all boils down to the cost, you know. Yes, the capital investment itself is very costly, but that is not directly reflected or translated to the patient's bill, believe it or not, okay? So I can tell you, in India, whichever hospital buys a robot, they don't run it for profit, okay? So it is mainly to get the benefits translated to the patient's outcome, and that is for sure, because I know the numbers. So typically in a general class, you may be looking at spending probably around 1 lakh more than the conventional surgery, and I think that is the ball figure which is followed. And in Hinduja, we have kept our packages very comprehensive and very attractive, so that more and more patients can get benefited with this technology. The next question is from Jocelyn Morris. I hope I pronounced that name properly. And she just passes on a comment, it's great to have you, doctor, online. Perfect, thank you. Thanks for joining me. Then the next question is from Anup. Anup is asking me, is robotic surgery beneficial for cancer conditions? Anup, yes. It is extremely helpful in managing various cancer surgeries. If you're talking about the urological conditions, prostate cancer tops the list. Then comes the kidney cancer and the bladder cancer. Let me give you some overview about these three cancers. So, why prostate cancer is, or this surgery is more popular in prostate cancer? So the reason for that is, I don't know whether you are aware where the prostate gland is. Prostate gland belongs to only in men. There is no prostate gland in women, okay? And it sits all the way inside the patient's pelvis. So your pelvic bones are covering the prostate gland. So in prostate cancer surgery, the aim is to remove the prostate gland in its entirety. You cannot leave behind any part of the prostate, or that is the aim of the surgery. And to do so, we have to actually cut open the patient below the navel, go inside, separate the prostate gland all along from its attachments. So the gland is attached to your urethra, which is your urine pipe. It is attached to the rectum, which is your stool passage pipe, and it is also attached to the bladder, which is the urine storage bag. And you have to carefully separate this gland from all three important structures and then take it out. Now, when we were doing conventional surgery, it was extremely difficult to reach to that area. So the bleeding used to be quite a bit. The tissue handling was not as superior. And there are certain sutures we have to take in that. And those sutures were like a nightmare. We used to do it, very effectively we used to do it, but it was a nightmare. Robotics has completely eliminated this kind of difficulties. So basically, these robotic arms, they go inside the pelvis. So basically these arms and my vision camera is sitting behind the pelvis. So I'm right in front of the prostate gland. And by using these superior articulating instruments, I can dissect out the prostate and remove it from its attachment. And later on, I can take those stitches in a very effective and precise manner. So I can even see the millimeters of tissues. It is that close. Of course, one of the drawbacks of the robotic surgery, which I can tell you now, is we lose the touch, we lose the tactile feeling of the tissue. And initially, it was considered as the biggest drawback in cancer surgery. So the cancer surgeons used to say that in cancer surgery it is extremely important to touch the tissue and feel that yes, this tissue is hard and we have to take more tissue out of it. But that's not true anymore, because with more and more surgeries we do, more and more experience we gain, the visual cues, what our eyes can see, and they start feeling the tissues actually. And we are not far from having a robot which will actually even give us the feel of the tissue. So it's going to happen, but at this stage there is no big difference in the cancer control if you compare the conventional surgery as against the robotic surgery. So definitely prostate gland has made a big way in cancer surgery with the robotic surgery. Kidney cancer. Kidney cancer, again, nowadays, 20 years back, most kidney cancers we used to find large tumors, 7 centimeters, 10 centimeters, and we used to end up removing the entire kidney. That was the treatment of choice for kidney cancer. Nowadays, with so many people going for annual health checks, or they are getting more and more health aware, we are finding smaller and smaller kidney cancers, and they are in extremely high cure rate, because if the tumor is less than 4 centimeters, the chances of curing a kidney cancer is quite high. Now, if we are achieving a cure by removing these tumors, we are now started preserving the kidneys. So if a cancer comes from the top part of the kidney, and if it is a 4 centimeters tumor, instead of taking out the entire kidney, you just remove part of the kidney along with the tumor. So the rest of the kidney is there for patient's body, for his functioning. Though we know that one kidney is enough for survival, but why to sacrifice part of the kidney which has not been afflicted by cancer? Now, robot again plays a big role here. So taking these tumors out with precision without damaging much of the existing kidney tissue is extremely important. And again, when we close down the kidney or once we chop off the tumor and close the kidney with sutures, that suturing is extremely precise by using robotic surgery. Third cancer is the bladder cancer, where we have to remove the entire urinary bladder of a patient and replace it with an intestinal segment. The patient will end up having a large incision if this kind of surgery is done by an open way. Again, it is still a gold standard to do an open surgery in cystectomy, because it's a very complex surgery. It takes long time, long hours, and it has got lot many kind of anastomosis, lot many things to be connected to each other. So the data is still not available, which one is better, open or robotic. We need more and more surgeries to be done in that way. But yes, it is doable. Patient who wants a smaller scar, earlier recovery, robotic surgery is applicable for doing bladder cancer surgery as well. So that's the kind of sum up about your question about is robotic surgery beneficial for cancer conditions? Yes, it is definitely beneficial. Sarita is asking me a question which is quite valid. Does robotic surgeon need to be specially trained, or any surgeon can do it? I briefly answered that question earlier. Just like when you start driving a car or when you start riding a bike, you need a licensing. And similarly, for operating a robot, you need a licensing. There are various ways how to obtain that licensing. So some surgeons, they actually get trained into operating on a robot for a year or 6 months or a couple of years, and then they work there. Of course, their experience is more. But the simplest thing is to get the licensing through the company where you know how to operate it. Because see, basically surgery is a surgery. You know how to do a surgery. You're just using a mediator like a robot to do the surgery. So for that matter, any surgeon, if trained, can operate a robot, which is true. But you just need that licensing exam. And once that is done, of course, all these surgeons are not left on their own. Initially, they are all monitored by a trained surgeon. And we make sure that every surgery goes smoothly, and there is a constant monitoring of these surgeons who are newly trained, and then only they can take on or take off thereafter. So it is a very structured program how one surgeon can get enrolled or can become a robotic surgeon. And it's very, the company has got a good governance on all these things, so as the Medical Council of India and various councils of different countries. So Rahul is asking me, why is there less blood loss during robotic surgery or robotic assisted surgery? Yeah, it's very simple, Rahul. See, here firstly, we are not making a big cut on patient's body. So we are making few tiny holes. So if you're cutting very small, you are taking a very small incision on patient's body, obviously it is going to bleed less rather than having a big cut where a lot many blood vessels, they get cut and it starts bleeding. Once you put the cannula inside, when we go inside patient's body, when the robot hands or the arms are inside patient's body, we get 10 times magnified vision. So the blood vessels, which we can see with our naked eyes in conventional surgery, if that blood vessel is say 3 millimeters, I will see it 10 times bigger. So I would be able to precisely pick it up. Either I can save it or I can cut it by taking due measures so that it doesn't bleed. And that's why the blood loss in robotic surgery is extremely low. So typically I can say that in a prostatectomy surgery, conventional way, if the blood loss is say average 800 ml, which is close to a liter, in robotic surgery it will not be more than 150 to 200 ml. So that much difference. So the chances of somebody requiring blood transfusion is significantly lessened with robotic surgery as compared to open surgery. And as we all know that blood transfusion, though it is a life-saving activity, it still has its own downside. So not all patients should be given blood transfusion. So that's why the blood loss is less. We still got time. Okay, so I'll take only a couple of questions here. There is one question by Kunal. Is there any cons of robotic surgery? I think I've already answered that. There is one more question which is quite interesting. Kanika is asking me. I think Kanika must be an IIT student. What is the future of robotics in urology? So I think her question is quite specific or quite general, I would say. What is the future of robotics in medical field or surgery? And I think it is just the beginning, Kanika, because what we see now, though it is a 5th generation of machine, there will be an explosion of different robotic systems which will come up in the market now in the next few years, because the patent for the existing robotic system has already run out. Unfortunately, no company could actually reproduce another robot because they had about 1 million patents with them, and now these patents are running out. So many more companies are coming into the market. However, having said that, the 5th generation robot is a really advanced machine, and what we have now at Hinduja Hospital is the state of the art. It has stood the test of time. It is a comprehensive robotic system. We have got all bells and whistles along with this machine to treat any kind of cancer condition or reconstructive conditions which are applicable in that situation. The future, now they are coming out with a single port surgery, where instead of making 5 or 6 tiny holes, we make a single hole. Through the single hole, different 4 arms or 3 arms, they go inside patient's body, they spade out, and then they operate. So instead of having 6 incisions, we just make tiny, one small incision, and through that we carry out the surgery. Then the future is the computerized surgery. So you incorporate a computer along with the robot. Then the imaging is incorporated. The X-rays and CT scans and MRIs, they are incorporated in the robot. So it is called as it is like a GPS. It is a mapped surgery. So you know where the cancer is, you know where the organ is. So you will get constant voice over control of the robot, that okay, Dr. Santoshi, you are too close to the vessel, you stay on the left side. So it is getting more and more advanced, and it's happening. It is going to happen. So the robot will tell me the cancer is situated 2 centimeters to the right, so you stay more closer to the tissue. And so there is no limit for evolution of this robotic system. It is getting more and more advanced, and I think years to come, I think 80 to 90% of the surgeries may get replaced with robotic surgery. It is something in thing, and it is going to stay there. Lot many technologies, they come in and they go out of the window in no time, but robotics now, it's almost 19 years it's in there, and it's picking up quite rapidly. In India, we are not far. We are technologically as advanced. It is quite easily available. The only downside in India is still the cost factor. But if you look at if you compare the benefits of robotic surgery, probably the cost factor may get eliminated. So I think that answers your question as well. Any other questions remaining? So thank you all for staying with me, and if you have any questions or any more questions, you can always get in touch with us through the Hinduja website, or we'll just give you a link down there, and you can post your questions, and I will try to get back to you as soon as possible on those questions. Thank you very much.